Hello guys, welcome. Today I want to answer a few questions that have come up since a video that I did on amlodipine. In that video I did a complete review where I looked at the side effects, the uses, the mechanism of action and so forth. And a couple of questions seem to be recurring. So I just thought I would gather the top ones. I think there are about 7 or so of them and answer them so everybody would have access to it and I don't have to keep, responding individually. By the way, my name is Kweku. On this channel, I do medication reviews and I discuss healthcare topics that are of interest to a lot of people. So if you're new around here, please do well to hit that subscribe button and don't forget to hit the notification bell as well so you get alerted when I release new content. So amlodipine, the questions that have been occurring. The number one question that seems to keep repeating itself is, can I take calcium supplements if I'm taking amlodipine? And I understand where this question is coming from because in the video I explained that amlodipine is a calcium channel blocker and it works by inhibiting calcium ions into the cell, and in so doing it relaxes the muscles, the blood vessels are able to be dilated, and because the blood vessels become dilated, the blood is able to flow easier because there is less resistance, leading to a lowering of the blood pressure. So the question is, would calcium supplements compromise this process? The answer is no. Studies have shown that dietary calcium or supplements are not enough to impede this process or impede this mechanism of action of amlodipine. So it's okay if your doctor has determined that you are low on calcium and has prescribed calcium supplements for you. It's perfectly fine to go ahead and take your calcium supplements. The doses that we get from the over-the-counter or the supplements they are not high enough to impede the activity of amlodipine. On the other hand, people getting high doses of, say, intravenous calcium, those people stand the chance of it affecting their amlodipine. So in those people, usually maybe they'll make a dose adjustment or something, but that is rare. It's very rare to see people getting calcium supplements intravenously anyway, but that's it. So yes, you can take your calcium supplements if you need them. The second question is, can amlodipine cause weight gain? Technically, yes, amlodipine can cause weight gain in a very small percentage of the people, about 1%. Usually, this weight gain is due to fluid accumulation, which has to be taken care of anyways. So anytime you take amlodipine and you see that you're gaining weight, especially if you're gaining it rapidly, or if you notice you can actually identify that you're retaining fluid, it's a good idea to have a discussion with a doctor, because what happens is that such fluid retention and weight gain is usually dose dependent. That means that the higher your dose, the more likely you are to see such fluid retention. So in most instances, if that is the case, they may do a dose adjustment. Another tip though is that you may also want to watch your sodium intake, because definitely anytime you have high sodium in the diet or high sodium in the blood, it tends to accumulate fluids. So if you take amlodipine and you notice any kind of fluid retention, aside talking to your doctor, in the interim, watch your sodium intake and reduce it. Another question that kept coming up is amlodipine harmful to the kidneys? And the answer is no. On the contrary, amlodipine, or for that matter, any blood pressure medication that reduces your blood pressure, actually protects your kidneys and reduces your risk for developing chronic kidney disease in the long term. So no, there is no proof that amlodipine actually aggravates any kind of kidney problem. On the contrary, it actually protects your kidneys, because anytime you lower your blood pressure, you are giving your kidney protection, if I can use those words cautiously, and it tends to delay or even stop chronic kidney disease. The next question is, what time of day is best to take amlodipine? Well, it doesn't really matter. Amlodipine can be taken irrespective of the time of day. You can take it at bedtime, you can take it in the morning. The most important thing is to be consistent. So if you decide that you're going to take it in the evening, stick to the evening dose, because you don't want situations where sometimes you take it in the evening, sometimes you take it in the morning. You wouldn't get the maximum benefit out of it. So just decide the time when you are most likely going to remember, and then just stick to it. It doesn't matter if it's taken at night or during the day. Another question that I saw was, does amlodipine cause swelling of the gums? And the answer is yes. It is one of the very rare but potential side effects of calcium channel blockers in general, not necessarily limited to amlodipine. It's a condition they call gingival hyperplasia, where you actually see swollen gums in people that take amlodipine or some calcium channel blockers. Unfortunately, if you are one of those that develops this, usually your doctor may want to switch to a different medication. So it's just what it is. There are other alternatives. You don't have to suffer through one if a medication is causing you problems. And gingival hyperplasia can be serious. I mean, it can obviously deform your gums and stuff like that. So yes, if it happens, rare though, but if it happens, it will be a good idea for the doctor to switch to something else. And then another question that I get is, what do I do if I miss a dose? You know, people are sometimes concerned if they should double up or they should wait till the next dose. You don't want to double up on amlodipine if you miss a dose. If you miss a dose, take it as soon as you remember. But if you notice that the time for your next dose is closer, then just go ahead and skip that dose and take the next dose and then just continue your cycle like that. So for example, if you remember that you missed your dose, you normally take your dose, say maybe 7 o'clock in the morning, and then you remember 10 o'clock in the morning that you missed the dose. Yeah, just go ahead and take it right there and then. However, if you didn't remember till like 9 p.m. at night or at bedtime, you're going to go to sleep, then obviously the better option in that circumstance is just to wait and then just take it in the morning when you wake up and then just repeat the cycle and continue like that. Another relatively common question is, when can I stop taking amlodipine? In other words, when can I get off amlodipine? This question sometimes gets me a little concerned because once people's blood pressure gets controlled, they deem it that it's time to get off the medication, forgetting that it is actually the medication that has kept the blood pressure in control. So to answer the question, when can I stop taking amlodipine? You may not want to hear this answer, but chances are that unless something drastic has happened, some miracle of some sort or some underlying cause of your blood pressure has been found and taken care of, you will need amlodipine to maintain your blood pressure within the limits that it is doing. Then the risk is that if you stop taking any blood pressure medication for that matter, you risk what is called a rebound hypertension, where your blood pressure can go through the roof and it could be life-threatening. So the answer to that question is definitely work with your doctor if you have to quit amlodipine. Of course, if you're having some reaction or a side effect unbearable, you can discuss with the doctor and go off it. You know, they will taper you off or replace it with something else. But do not on your own accord stop taking amlodipine or any blood pressure medication for that matter. So those are some of the more frequent questions that I've been receiving. I'm open to answer more if you leave them in the comment section. But in the interim, these are some of the most recurring ones that I've seen. So let me know if you have additional questions. I'll be more than happy to take a look at them and address them as I have the opportunity. Thank you so much for staying through again. And if you haven't subscribed already, do well to do so. And I'll catch you on the next one.